Hi, everybody. It's Audrey.
Hey, Audrey, you're in the city by the bay again.
Yep.
Okay. All right, Catherine, I'm going to start the webinar. Just that'll start letting people in as attendees. We are live streaming and recording now.
Hi, everybody.
Howdy.
I have the light behind me on. You can't see me on the screen. Yeah.
See somebody who has logged in as LG GPad F2. Could you let me know your name, please?
Who, me?
And maybe
yeah.
you should turn it off if you don't mind.
Screen the screen name coming in is LG GPad F2 8.0.
Oh, sorry. Let me put my name in. Sorry.
Can you update your name? Thank you.
Thanks for your assistance, Mark.
Oh yeah, I'm the amateur IT guy.
Welcome, everyone. Good to see everyone here. So Mark, is Shelley here?
Shelley is here.
Okay, great.
And I think you have a quorum, so start whenever you're ready.
I didn't realize I was muted. I was saying so many things.
Oh no, okay.
It's very interesting.
So Shelley, do you want to start?
Sure.
If you have, there are things that you wanted to say, and then I'll provide an overview of the topic and the agenda.
Okay, so we welcome you to this important meeting. The Catherine will go over the overview, but this is again consistent with our meetings, consistent with our district needs statement, our priorities that we've set forward, and that's how we're setting our agendas. We are glad to see our committee members, but other board members and other people join us. I think the issues that we're touching are ones which we can all learn from, even those that are experts. Agencies can learn from one another, and people with different experiences can learn from one another. I feel tonight's topic's a very sensitive topic, and needless to say, we expect that everyone will be not only respectful, but understanding, and no question later on is a stupid question or not an appropriate question if it's a sincere question. And they'll help us learn and help us understand. The format will be that each of our speakers will present. If you have a question and afraid to lose it, please jot it down. Okay, so you can ask it after all the speakers have spoken, and then we'll have questions and comments to follow. Are there any
Kelly,
questions?
if I could jump in on that last
Sure.
point. Thank you. Sometimes folks put questions in the chat and sometimes they put them in the Q&A. My strong recommendation is that everybody put questions into the chat, because at the end of the meeting, the chat is saved. I am not aware of an ability to save the Q&A. So it would be better if, especially if there's questions that need to be followed up upon, by saving the chat, we will be able to save your questions. But the Q&A is ephemeral and disappears when the meeting is over. So with that, I'll give it back to you.
Thank you.
Okay, so are we ready? So I'll
Please,
start.
please, Catherine.
So we envision today's meeting as an opportunity to discuss ways to respond to child abuse and support the mental health and safety of children. We're excited to have Safe Horizon, New York City Alliance Against Sexual Assaults, and the Mount Sinai Sexual Assault and Violence Intervention Program, and others with us. We're especially interested in learning how the city and our district can increase the availability of forensic examiner and trauma-informed practice training for doctors, physician's assistants, and nurses, child advocacy centers, child-centered facilities, and more free and affordable mental health care for children and youth, especially those who have been abused or in challenging situations. Our meetings can, as Shelley mentioned, our meetings can serve as a forum to provide education to the community and brainstorm methods of advocacy. So we're hoping from this session, we can learn how to support the important work of these organizations doing this great work. So from Safe Horizon, we have with us John Pickett, and please let us know if we mispronounce your names, because it's important to us to get that right. We have John Pickett, Michael Pollenberg, and Nancy Arnow. From New York City Alliance Against Sexual Assaults, we have Sarah Zaidi with us. And from the Mount Sinai Sexual Assault and Violence Intervention Program, we have Lynn Frederick Hawley and Angela Fernandez. We may have a pediatrician with us later, whose name is Olga Jimenez. The protocol for the discussion, as Shelley mentioned, is that the speakers will each speak in the order that I just read. Shelley will call on them. And after everyone finishes, we'll take questions in response or comments from the Health and Human Services Committee. We'll call on each person, and then board members will have the opportunity to ask questions, and then the public. So I will hand it over to you.
Okay, great. Madge, would it be too much of an imposition to take minutes?
I'm taking minutes, but I'll have to get the names all straight for me.
Great. Well, I'll send them to you. Thank you very much. Okay, we're going to begin with Safe Horizons and John Pickett. John, could you identify yourself?
Yes,
Okay.
Hey, everyone.
And we're not going to put a limit on time because we asked for we outline the information we're interested in, but whatever you have to share with us is very important. So please don't restrict yourself.
Absolutely. Thank
necessarily.
You. Yeah. And if it's okay, I'll have my actually my supervisor, Nancy Arnow, start from Safe Horizon, just to kind of she can speak to some of this, and then I'll follow up with her if that's okay.
Okay.
Awesome. So hi everyone, I'm Nancy Arnow. It's a pleasure to meet you. And I'm the Vice President at Safe Horizon of our Child Advocacy and Mental Health Services. I actually have grown up and grown old at Safe Horizon. I've been there over 30 years. It's kind of remarkable. And I must say, in all these years, these past 8 or 9 months have been some of the most challenging that I can remember. So I just applaud all of you for even being on this call. It's kind of cool to see kind of inside your homes and our homes. You know, we enter a new world this way, but so I'm just going to give you a little context, and I want to apologize. Michael Pallenberg had a death in his family, so he's our Vice President of Government Affairs, but I don't think he's going to be able to join us. So I'm going to just give you a broad overview of Safe Horizon, touch on a couple little points of child focus programs that I think you might be interested in, and then John, my fabulous colleague, is going to give you an inside view of what's going on at our Manhattan Child Advocacy Center, which he is the Senior Director of. So for those of you that have been around, Safe Horizon was really established back as Victim Services back in 1978. And over these decades, we've really tried to stay true to the needs of what are the needs of child victims, adult victims, all kinds of victims of crime and abuse. And I think, you know, back in the day, we were kind of the only game in town. Now I'm thrilled to hear some of our colleagues on this call, you know, that there are more services available in our community. But I think the needs of victims of crime and abuse are more complex now than ever before. And I think the amount of loss and trauma and the cumulative impact that we're seeing in our programs across the agency are just profound. And I'm deeply concerned about the financial impact that I think we're all bracing for. So just very broadly, you know, it was Victim Services. Safe Horizon is really the nation's leading victim assistance program. We have about 1,000 employees now. We provide services in all 5 boroughs. And I think we've done a pretty remarkable job even throughout the pandemic of primarily providing remote services, trying to knock down every barriers there are for victims to still access help. We have 24-hour hotlines. All of our services that we're primarily providing in-person services are providing remote services, but we have had some of our key essential programs remain open every day throughout the pandemic. And those are our 8 domestic violence shelters, our street work program for homeless youth, which has both drop-in centers in the Lower East Side and up in Harlem, as well as an overnight shelter. And our 5 child advocacy centers have also stayed open every day during this pandemic that investigate and respond to the most serious cases of child abuse. All of our programs are really there to provide assistance, advocacy, and support to victims, whether you're really infants and toddlers all the way up to elderly. And we deal with every kind of crime, domestic violence, child abuse, rape and sexual assault, human trafficking, youth homelessness. And our staff are now in every precinct. They're doing it remotely right now, but every police precinct through our crime victims assistance program, where we have advocates to really try to help crime victims of all kinds in the precinct. We have community office programs in all the boroughs. We are in the family justice centers that many of you are aware of. We're in the criminal courts, the family courts. We have an immigration law project and domestic violence law project where we have attorneys and paralegals who are providing free expert legal assistance. We have a counseling center that has been very dear to my heart that provides evidence-based mental health treatment from infants all the way up to elderly. We have switched over to providing telehealth. So we are finding that that's actually knocking down many barriers historically that the children and families had coming into clinics. So we're really kind of thrilled that actually through telehealth, we're providing these services remotely. So I could go on, I don't want to bore you, but there's a whole lot of programs, and I would encourage you to visit our website, safehorizon.org. Which would give you, you know, a thorough understanding of what we're doing. But I'll just close by saying, I've been here a long time. I think I'm a little not objective anymore, but I really feel we have some of the most compassionate staff that we ever could have. I feel really humbled by the type of expertise, the passion that they're just driven whether it's coming in every day during these rough conditions to be there for children and families, or from their bedrooms or living rooms, wherever they can provide remote service. And I'm also humbled by the thousands of victims that have shared their journeys, their struggles, and us really partnering with them to try to stay on top of their very complex and evolving needs. So after all these years, I'm still humbled to be part of this organization, and I really welcome the opportunity of learning from other organizations. I feel like we're always in a state of learning and sharing. So if you've ever, when things get better, if you ever want to visit any of our programs, we love to give tours. I'd love to hug people again, hopefully someday soon. So virtual hugs. So with that said, I'm going to pass it over to John Pickett, who is really remarkable. He's our Senior Director of our Manhattan Child Advocacy Center. And is just phenomenal. So I'm going to pass it over to John Pickett.
Thank you, Nancy.
Thanks, Nancy. I'm lucky enough to have her as a supervisor, so I feel really grateful about that. And just again, I want to thank you everybody for just having us here. I know this time period can be overwhelming, even just the day-to-day of functioning. So in addition to that, having someone come talk to you about like child abuse can be a lot, or other types of abuse is a lot to even think about. So I just thank you for even taking that on and considering that. So as Nancy mentioned, I'm the Senior Director at the Manhattan Child Advocacy Center. And if you will, I without getting too much into it, before I even say anything, I just want to point out, whenever I talk about child abuse, I like to point out, because we know statistically, 1 in 2 children will be sexually abused before they turn 18. And the numbers are high also for physical abuse. So that this
Excuse me.
Oh, yes.
Could you just repeat that? That got kind of garbled. I want to get it right.
Oh, absolutely.
I'm sorry to interrupt.
Yeah, no, please. Of course, that we know that 1 in 10 children will be sexually abused before they turn 18, statistically speaking. And I bring that up in part just to kind of point out that this is obviously something that happens way too often, and that it's also probably impacted people that are listening tonight. That this is not an issue that happens to others, it's the other people's issue, or the people that live, outside New York City. This is a very much relevant to even many of us here. That people here could certainly know somebody, or even be impacted themselves by child abuse. And as even when I'm talking tonight, I'm not necessarily going to get into lots of details about it, but just to be aware of how we're ourselves are reacting to this. I think it's just being self-aware, knowing that this is the goal is not to try to scare people or anything like that, but also our own reactions. I've been doing this a long time, a number of years, and I still, at times, like I still can get it can be reactive even for me, hearing stories of children who have been abused or hearing their stories. So I just want to be aware of that for all of us, and being taking care of ourselves. Along those lines, I know we know that, like I said, the rate is high for children, and back in the 80s, there was a prosecutor actually by the name of Robert Bud Kramer who looked at this issue and said, he was prosecuting actually in of all places in Alabama, I don't know, just randomly, but and some of you might be from Alabama, which is great. But he looked at it and he's like, children who disclose some type of abuse often end up in hospital emergency rooms, where they get interviewed repeatedly by nurses, doctors, and not because they're intending to do that, but it's just part of the process. They get interviewed, they get examined, they end up in precincts, which if you hopefully you haven't had to be a precinct recently, but precincts are not even adult friendly, for maybe good intention, I don't know. But it can be, as a child, seeing what happens in a precinct, people getting arrested, handcuffs. And I know even before we opened the Child Advocacy Center here, detectives would tell us about, that they would interview children and have children sit at their desk while they talk to their mother, or interview children in the lineup room, or just kind of wherever that could happen. And the Robert Bud Kramer in the 80s said, well, why can't we do this differently? Why does children and families have to go to all these different offices of people who are investigating these child abuse allegations? Why can't we change the system to work better for children and families? And so he came up with this idea of a child advocacy center, of a place where everybody who's involved in child abuse investigations would come to one place, would be in one place, and those children and families would come to that place and have a one-stop shop, if you will, or one place where they can receive the services. The investigation can happen in one place. The child could be interviewed the least amount of times, but hopefully one time where we have interview rooms here, observation rooms where people who are investigating can watch that interview. We have specially trained social workers and other members who how to interview children. I mean, there's a whole lot of research, a whole lot of training, and that goes into how do you interview children. And then Safe Horizon here at the Manhattan Child Abuse Center. And just to give you some idea, this includes, well, pre-COVID and hopefully after COVID, post-COVID, includes about 55 people on site here, including members of the Child Abuse Squad from the NYPD, a prosecutor, 16 people from Safe Horizon, people from ACS, and medical doctors who specialize in child abuse, or child abuse pediatricians. So all of these are here and in order to support families who are going through some type of child abuse investigation. And I want to point out too, it's not just families who, unfortunately, a lot of the families come here are not here because of something that happened, because there may be some kind of miscommunication. Unfortunately, maybe there's somebody made an allegation that wasn't true. We're also here to support those families that unfortunately have to go through this process, which is, I think for all of us, is pretty daunting to talk to, maybe the detective, think of the detectives involved, or ACS, or all these people. We want to minimize the impact that has on a family as much as we can. So Safe Horizon provides those services and assistance in conducting forensic interviews with children for the team. We also provide crisis counseling and support services. As soon as they walk in the door, we're working with that family to do what we can to support them right after the interview, whether that's the caregivers, the children, and we continue as long as they need to, or connect them to services or other resources in their community if they're not near the CAC, our Child Advocacy Center. Excuse me. And what, so that's, and here at the Child Advocacy Center, as Nancy I think mentioned, we see the more serious cases of child abuse. So we see sex abuse, severe physical abuse, and fatalities typically. Those are the areas or categories, I guess you might say, that we see on a regular basis. We continue to stay open during the pandemic. We're at about 75% of volume. We normally see over 1,000 cases a year. We conduct over 1,000 forensic interviews of children a year related to those types of allegations. So that's a big part of what we do throughout, obviously, what we're doing on a regular basis. I think about, and I think it was Catherine and we're talking about like what can you do? Like what are people who maybe aren't doing this specific work, but obviously care about your community and care about, as individuals. And I often talk to people, whenever I do a presentation, I talk about the difficulty children have to disclose abuse. We know that 55 to 70% of children who are sexually abused do not disclose being abused till they're adults, if ever. And there's an incredible amount, and I could talk for another hour about, stories or real life situations why children didn't disclose. And there's so much shame involved in that, and societal pressure, community pressure, and even family pressure for that child not to disclose. So I encourage, for all of us, I think it's all our duties to try to figure out how do we make it easier for children to disclose. I think often we're because of the stigma even around sex, but a stigma around child abuse, it's not something people want to think about, and certainly it's not something you want to talk about normally. So I think children often, and we often pick up on that. Children are very perceptive, and we see children. I myself was a forensic interviewer, interviewed hundreds of children, and numerous children who have said, I don't want to talk about this because when I talk about it to my mom, she started crying. Or when I said something to my teacher, she got really upset. or felt really, so children pick up on this, and I think oftentimes that either delays their disclosure of abuse or keeps them from talking about it at all. So I think as community members and leaders in the community and family members, one of our primary goals is to think about how do we make this easier for children? How do we become more comfortable talking about abuse, where it's part of our vernacular? Not that we need to talk about it every day, but how do we make ourselves more comfortable talking about these issues and making it out there, so resources for individuals and so that there's less shame connected to it, there's less taboo, and that we're able to address it and support our children even more than we do now. So I think those are some of the things, and we could talk more, and I'm sure there'll be questions, but and ways we could try to connect. But just generally, that's a little bit overview of our program and some of the pointers I just want to make.
Thank you, John.
Thank you.
Thank you. If I could jump in just for a quick second, I wanted to acknowledge that Councilmember Helen Rosenthal has joined us, and we are grateful for your presence. I understand the council member is not under time pressure and so can wait until the end of the presentations. Is that correct, council member, or do you have other commitments?
No, I'm here. This is my last Zoom of the day, and I think I look like it, but I'm really, really happy to be here. It's sort of like being at a wedding when you see two of your worlds collide. My day job is working with Savvy and Safe Horizon, the New York Alliance. These are the best of the best that you're hearing from today. So it's an honor to be among you.
Thanks for joining us. Shelley, back to you.
Thank you. Okay. The emphasis at the end was sexual abuse, and we're going to transition to Sarah Zaidi from New York Alliance Against Sexual Assault. Welcome.
Thank you. And thank you all for having us and putting this together. It's, when we first started talking about it, I was talking to Catherine, and the conversation arose from the needs that we were seeing particularly heightened through the COVID pandemic. And I just want to thank Nancy and John for keeping the CACs open, because that is, we work very closely with John, who does many of our trainings, but the child advocacy centers are really what we need. The kind of the wraparound services that they have for children, which is a welcoming space, and it's a one-stop shop, sort of what the family justice centers are for adults facing gender-based violence. So that is what we need basically in the community. So before I go into needs, I'll give you my background. I am by training a physician, but I've been practicing child therapy for many, many years, which is why child abuse and trauma with children is my passion. And I see, especially during the COVID pandemic, we saw an increase in anxiety. I saw a lot more cases of abuse, and I saw a lot more cases of suicidal tendencies in children as young as 6. And so that's where this sort of conversation stemmed from. The New York City Alliance Against Sexual Assault was founded in 2000, 20 years ago, by rape crisis programs in the city for them. And the idea was that because rape crisis programs at that time had limited resources, the idea was for an organization to help them with systems advocacy and with sort of the larger policy pieces in legislature, and government. Since then, obviously, things have changed, because now sexual violence work is not as taboo. It's the conversations are, and also there's more of a cross section between domestic violence and sexual violence and IPV and all of that, whereas it was very separated before. I think Savvy was one of the few places that was providing those services. But now there's a lot, like Safe Horizon is doing it. A lot of other organizations are doing it all together. Our role, therefore, has changed as well. I mean, we basically, in terms of specific to survivors, we provide direct services for legal representation as well as for counseling, but it's short-term counseling, because what we do is we provide crisis intervention, and then we actually provide warm referrals to places like Savvy and Dove and Safe Horizon, so that the longer-term work can continue. And our focus, therefore, then stays on policy and ensuring that the voices of the rape crisis programs across the city are being heard across the board. We also do, a large part of our work is training. And we are the largest organization in New York State, actually, that does in-person trainings for forensic examiners. To medical providers, that is nurse practitioners primarily. MDs are invited, physician assistants are invited, but they don't require certification to do a forensic exam. And that's actually one of the reasons why I asked Dr. Jimenez to join us. And hopefully she will be able to talk to that point a little bit more. But we provide a 5-day course. It's a 40-hour training that is certified by the Department of Health and by the International Association of Forensic Nurses to train nurses and medical professionals to provide a trauma-informed forensic exam when a survivor first goes to the ED. Obviously, that can be a very triggering event, and the idea is to make it a survivor-centered forensic exam when they go in. Essentially, this is the rape kit that in layman's terms. What we recently, the training had been happening for adults and adolescents for a long time. But when I came on, I joined the Alliance a couple of years ago, and I realized that there was no training for pediatric patients, that there was no forensic evidence collection for pediatric patients. And so we made a real push for it. And we've actually had 3 trainings now, and we've trained approximately 60 individuals to provide safe exams on children younger than 12. This was a huge accomplishment because no one else in the city is doing this, or even in New York State. It's IFN provided, the International Association for Forensic Nurses does that. It's virtual, it's an online, it's spread over many, many months. Ours is 5 days. And then, we do like clinical exams, and we actually have live gynecological teaching associates come in so that nurses can practice a pelvic exam, as well as the interviewing process, and a medical exam, a head-to-toe exam, so that obviously in children it's not invasive, and so it's a very different looking exam. And we work with certified trainers, certified nurses who've been doing it for over 30 years. So that is something that we've been doing. One of the challenges we faced is in providing preceptorship. Preceptorship is something that is a requirement to be certified to become a SAFE P, which is the designation for the pediatric nurses. Preceptorship is, so basically a nurse, before she starts or before they start doing the exam on their own, they need to be under supervision for at least 3 to 4 exams. Now, there are because there are few people trained in that, therefore there are very few people to supervise them. So what we've done is we've partnered with TeleSafe, which is a telehealth program in upstate New York, and we've been working with hospitals because they're funded by OVS. So there's no cost to hospitals, and it's just like paperwork. But even with that, we are finding resistance from ED directors. Just because, what happens is then there's a cost to them for providing on-call nurses, because you do need to have somebody on call. And so obviously it's a cost thing. So one thing that you all can do is push for more funding for something like that, to provide a roster for nurses that can be available, that have been trained in the pediatric course. The other thing that we've been trying to work on is with these child abuse pediatricians to provide preceptorship, as well as with Dr. Brown, who's at the CAC, to allow 1 or 2 nurses that have graduated from a program to be under their supervision for as long as possible. But because there are literally 4 to 6 individuals who are able to provide the supervision, we're really struggling with, we have 60 nurses who've graduated the program. So by the time they rotate, it's going to be a while. So that's something that we really need to push for as well. And then the other thing we do is we provide training in terms of trauma-informed and best practices to community-based organizations, to rape crisis programs, lawyers, anyone that comes into contact with survivors. And what we've noticed is that everyone believes that they're survivor-centered and trauma-informed, but when you actually put them in the hot seat and you do some role plays, you're like, this could use some work. So we've really been trying to push for that. And I'm a doctor, so I can say this and I can diss us, but we are the last people that are trained in a bedside manner, to be honest. It's like we were told to take a history and leave the rest to social workers. That is what our training is. That should not be the case. Anyone that interacts with a patient should be able to have a conversation that makes them feel safe, and in power and in a position of power, because when somebody has been abused, that power and control is taken, especially children, because they've never been able to make decisions on their own. Even if they've been brought into the ED, it is not their decision, it's their parents' decision. So all of these situations are problematic, right? So we do provide a lot of best practice support to physicians. I mean, one of the things that we're doing now is to provide shorter trainings for residents, because again, during my residency, and as far as I know, residents are not trained in forensic exams. There's not even it's an elective if you want to become a child abuse pediatrician. It's an elective. It should not be an elective. This should be a requirement. So we're offering free trainings for whoever is interested. And again, it's been hard to get into hospitals because hospitals are, we don't have the time. It's not a priority for them. And this is a problem because when a child, unfortunately, we encourage everyone to go to the CSC for a forensic exam because that is the place to go. But there are some that go to the ER, right? And then what happens is, because a regular physician is not allowed to do a pediatric exam, they call the pediatrician. And if the pediatrician is not trained in that exam, then it could go awry. I mean, it's not the most trauma-informed. And with children, you have to be able to engage them in a certain way. You have to make them comfortable. Consent is a huge thing. They think that the consent comes from the parent. No, it does not. It comes from the child. They're human beings. You have to make sure that everybody knows what the legal rights are, what minors' rights are. So there's a lot of work to be done in providing this information to medical professionals. And then finally, the need that we felt was, the area that we felt was most lacking was psychiatric care in the city. Free services for children and adults, but since we're talking about children, it's very, very hard to find. I know that every nonprofit that we have tried has a wait list of months, it's 2 to 3 months long. If a child has been abused, you want to get them in right away if they are ready to speak. And even if they're not, you can provide them with that support. Now it's, the CSC again is a great place, but you have to be in the system to utilize those services. And ideally, it would be great to replicate what the CSC has so that it is available to everybody, to all children that are either part of this, that are not part of the system, right? Like there's some families who do not want to make a police report. Of course, ACS, mandated reporting, and there is a requirement for that. But there are times when you don't know, right? And a child may there's play therapy has such a large part in all of this. I mean, I've done play therapy for years. I mean, stuff comes out through play therapy that doesn't come out otherwise. But, and then of course, if you need psychiatric help for other issues, there are very, very few people that are willing to do sliding scale or do it for free. It's either you have to pay with insurance or Medicaid. It's just such a dearth of good child psychiatrists in the city. And so I would love to see more of that, and a center that perhaps has all of these services in collaboration with our child abuse pediatricians and the CAC, so that we all, it's a wraparound, right? Savvy is one of the few organizations that actually provides child sexual abuse services. There are very, very few organizations that focus on children, and 70% of the abuse occurs in children, in people under 18. So imagine that. We are so focused on adults, but the children are the ones that need the help. I mean, we are always, I personally, in my practice, I'm always at a loss at who to refer to if someone doesn't have insurance, can't afford $150 fee, and isn't willing to wait for the 3 months that a nonprofit is, requires them to wait for. So that's where we are in terms of the needs and kind of what we are involved with the children's work. We do provide child services, like child therapy in our offices as well. But again, it's crisis counseling, it's short term. We have a wait list as well. We see adults and children. We have creative arts-based therapists, drama therapists, and play therapist, but it's limited. So that's my spiel. I'll wait for questions later. Thank you all.
Shelley, you need to unmute again.
Sarah mentioned Savvy a few times. Savvy is Mount Sinai's sexual assault and violence intervention program, extraordinary program. And we'll start with Lynn. Lynn Trevor-Cawley.
Thank you. And thank you all for being here. As was mentioned early on, this is not the brightest topic to be discussing on a December evening. So I appreciate all of you being here and being interested in talking about child abuse, and not just about it, but what we can then do about it. And certainly hats off to my colleagues. One of my favorite things about working in the anti-violence efforts in New York City is how we all work together. I've been doing this work for about 27 years now, and I've done it across 3 states, everything from super rural to hyper urban in New York City. And there is nothing like the collaboration of organizations and agencies within the city that I've ever experienced. I started with Savvy in 2005, and right away from the beginning, you could tell this was a whole different animal, because partly on the negative, it's because there's so much work to go around. We're not competing. But it's also this genuine sense that people want to do what's right for survivors. And so however we can all work together is what needs to be done. And we do it. So it's really good to see you all from Safe Horizon, and Sarah and Helen, as we are part of your day job, as you said, all here plus all of you. So to give you just a little bit of background about Savvy, and then because so much has been said that I would just repeat, I won't do that. I'll tell you a little bit about what we specifically are focused on in terms of children's services. But Savvy started in 1984. We started out as a rape crisis program that only responded to the Mount Sinai Hospital in East Harlem, to that emergency department. How it began was in the 80s, New York was actually pretty far ahead of the curve in terms of providing treatment for sexual assault survivors. But we still had a lot to learn, and it still wasn't great. So one night, a survivor came into the emergency department who had been sexually assaulted. And after she had been treated and discharged, medical students that had been working in the emergency department that night said, "We have got to be able to do better than that." And they actually pulled together a proposal for starting a rape crisis program. They found a wealthy donor within the development section of Mount Sinai Hospital and sat down at her kitchen table and created Savvy. One of the reasons I love that story is just because it's fun and cool and grassrootsy, and I'm all about that. But I think because we started that way, we've carried that thread through our evolution as much as possible. So what we've really tried to do is be responsive to community needs, and that's how we've expanded. So from just being rape crisis, as Sarah said, we started to incorporate pretty early on domestic violence and specifically intimate partner violence into our services, because those were folks coming into the emergency departments as well. Then there were several other hospitals in both Queens and in Manhattan that reached out. They realized that we had a program where we were sending volunteer advocates certified through a 40-hour training that we provide that is sanctioned through the Department of Health. They said, "Hey, can you do that for us as well?" So we expanded to the point where we are now in 11 different emergency department and urgent care settings. So Mount Sinai, Manhattan, Mount Sinai, Queens, Harlem, Metropolitan, Lenox Hill in the Upper East Side, Mount Sinai, Queens, did I say that? Elmhurst, Queens Hospital Center, and Mount Sinai, Brooklyn, plus the East Harlem Health Outreach Program, and Upper West Side Urgent Care. I always feel like I'm being like an IQ test or something when I'm rattling that off. Like, am I going to remember them all? I'm counting on my fingers. So we have about 193 certified volunteer advocates at this point who go on call on a volunteer basis, and at any time on their shift can be dispatched to any of those locations to serve survivors of sexual assault, intimate partner violence, sex trafficking, and child sexual abuse. They're extraordinary people, I have to say. Then what happened after people are seen in the emergency department? What then? Unfortunately, many people who experience acute trauma, they don't want to engage in services right away. They really need a break. They think that it's probably something if they don't talk about, they can forget about. They realize a little bit further down the road that that is not happening and that they're having a lot of aftermath of the violence that they experienced. So where do they go? What we decided to do was create therapy options for a range. We don't go as young as, say, Horizon does. It's not our specialty. It's usually children, say, school age, then adolescent, all the way up through older adults. We have a couple of people who specialize in elder care and elder abuse, survivors of intimate partner violence who are elderly. So we have 6 different locations now throughout Manhattan and Queens with 11 different master's level licensed therapists who provide free therapy. Typically short term, but we will see people longer because, as Sarah had pointed out, there's such a dearth of longer term options that, again, you have to be responsive to what the community needs, and particularly free services are very important. The therapists collectively speak 10 languages. So this is going to be another one of those IQ things, see if I can remember all of them. English, Spanish, Portuguese, French, Italian, Polish, Gujarati, Urdu, Punjabi, Hindi, and we're about to have someone who is fluent in Hebrew and sign language, someone who's working on that. So since I don't count them as 12 because we're not quite there yet, but pretty soon. But again, it's about being as accessible to as many people as possible. There are already so many barriers to treatment, stigma, family not being supportive, not knowing where to go, worrying about the cost, not having insurance, where are you going to be seen, how far do I have to go into Manhattan all the time if I'm living out in Astoria, whatever, that we're trying to reduce as many barriers as possible by spreading out where our locations are and being as culturally and linguistically diverse as possible. Specialized programs start to become an issue. So we developed a sex trafficking survivors program through the Queens District Attorney's Office, which turned into Queens Human Trafficking Intervention Court, which then expanded. Now there's Trafficking Intervention Court in every city in the state. But we do ongoing therapy for those survivors, and that tends to be longer term. Their abuse typically starts very, very young. And by the time they're tracked into a sex trafficking program referred to us, they've experienced such complex trauma through a lifetime that there is no such thing as short-term therapy or trauma or services or support for that. We do have peers from that program who have graduated to a certain degree, and we're trying to help them develop more skills. So they actually mentor other trafficking survivors who are still trying to get out of the life. And that's been incredibly effective. I think trying to incorporate peer support as much as possible with any of our survivors is really key, because you can visualize by seeing someone else who has overcome or at least moved forward that there is hope that you can do that as well. I think it's that role modeling that becomes incredibly important. We have a program specific for Orthodox survivors. Again, it was brought to us because of our location at Mount Sinai. The Orthodox community, when we started this 20 years ago, very insular, weren't talking about the problem in that community as much, the extensive child abuse, sexual abuse that was occurring. So we were approached and said there were a lot of people from the Orthodox community that come to Mount Sinai for healthcare or to do volunteer work or visit relatives, that they could say they're coming to Mount Sinai, go down into the tunnels, literally, that are underneath the main campus, come up into the Savvy office and be seen for trauma and victim therapy, go back down, pop up into the main building, and no one would ever know. It was a way to allow them a safety of coming for support without the community knowing. It's much more open now. There's no tunnel walking, but that's a program of ours that is consistently waitlisted, that there's just a great need and very few resources for that community. We have a full-time education and prevention department with 3 different full-time educators. And the piece de la resistance and why we are here to talk tonight, we have a couple of SAFE programs, so the Sexual Assault Forensic Examiner programs, both at Mount Sinai of Queens and at Mount Sinai in East Harlem. And we also send our SAFEs down to Mount Sinai Beth Israel. We have a roster of about 25 SAFEs. They run the range from RNs to APRNs to MDs to residents to PAs. We're very fortunate with the dedicated, committed, amazing people that we have who are really doing it because their heart is in it. They're very concerned about survivors who come in. So we have a schedule where, again, they're on call and they do 12-hour shifts at a time. Only 3 of those, with the help of the Alliance, because it had never been an option before, 3 of those are actually now trained to do pediatric exams. But 3 of them across 3 hospitals, you know, whether they're on call or not, what they have agreed to do is be available, if they're available, assuming they're not working, to take calls from the emergency department if a child comes in and there is no safe examiner that's pediatric trained, to at least do consultation, to at least talk to the attending, to at least run through or calm that person down. I believe that the anxiety that comes from a physician, a resident, an attending, whoever it is in the emergency department when they're confronted with a sexual assault survivor, particularly a child, is that they know how important it is. They know how fragile the situation is. They know how vital the evidence may be from a criminal justice standpoint. They know the trauma that this child may have experienced, and they don't want to add to it. It comes from such a good place, but it's very deep-rooted anxiety. So a lot of times it's a matter of kind of talking them through it. Ironically, I'm doing a training for the PEDS attendings and the adult ED attendings at Mount Sinai Morningside on Monday morning, specifically about doing pediatric exams. We definitely prefer them to go to the CACs. That is the stellar place. That is the best survivor-informed kind of care, particularly for children. But for some families, that isn't an option for any number of reasons. They're more comfortable coming to their community hospital. They were brought there, and that's where they are. So we don't want to have to transfer them necessarily, or timing is an issue. There are a number of things that might factor in. So we want to be able to provide the best care we can for kids when they're in that situation with us. What we need is more people to have the time to be able to go through the pediatric training, so that we have a deeper roster. And also, like Sarah was saying, the psychiatry piece of it is super important. Many, many psychiatrists, for adults as well as children, are actually opting out of insurance altogether. So you're talking a lot of psychiatrists who may charge, if you're lucky, $350 an hour. Your average family, it cannot do that. It's just completely out of reach for most people, and particularly when insurance is not any kind of option at all for reimbursement. So that is a particular concern for our adult patients as well as our adolescent and child patients. Also, I did want to say, because adolescents, and we say like 10 years old and up, there really is no bottom line for being able to consent to medical sexual assault care and related care in the emergency department. You have to assess the ability of that child, that young person, to understand the pros and cons of what they're being offered. One of the things that we run into and we work really hard is training medical staff in the emergency departments to know what those minors' rights are. As Sarah was saying, it's not immediately they're under 18, so the parent gets to decide. Oftentimes that's actually counter to what the young person wants, and would be contraindicated for them. So it's a matter of getting everyone to understand that there are so many things about children and adolescents and young people that are different that need to be taken into consideration. So it's a lot of training that needs to go on. And I will shut up now because that's all I needed to impart. I think your questions are probably much more important. So there you have it.
Thank you so much, Lynn.
Sure.
I assume Angela is not with you this evening?
Yeah, I'm sorry. She got ill at the last minute, so she wasn't able to come. So I'm trying to channel her as Helen and Sarah, I think, know Angie. She's a dynamo. I wish she were here. But I'm trying my best to
channeling her.
I'm sure you really filled in for the things she would have said, and we appreciate it. Thank you. Do we have Olga Jimenez with us?
I don't see her on our list. I've been watching the attendees list.
Okay.
Actually, should I look at I'll look at both lists. Nope, I don't see her yet.
I don't think so. Okay, thank you. Where is Helen Rosenthal? Hi, Helen. Would you like to speak?
Right when my mouth is full.
Oh no. If you want to
timed that well.
Okay.
Well, not much more. I'm really interested. Really.
No, I'm sorry. I didn't realize. And you're entitled to.
No worries. This is lunch.
Okay.
So, I mean, every time I hear these professionals, I learn something new. Their work is incredibly nuanced and hard. And so it was a pleasure hearing everyone tonight. We work together for the community board's benefit. I work with these advocates in my role as chair of the Committee on Women and Gender Equity. And we work together on policy issues like making sure that the NYPD is well trained, in particular their Special Victims Division, the division that is responsible for investigating sexual assaults, to make sure that they're trained in the trauma-informed ways that you just heard about tonight for how medical professionals are trained. And many of the people you see here are doing the trainings. And we work together on a variety of domestic violence issues as well. And we've accomplished a lot together, I think. I really do. And then in terms of the budget, these are the groups that I'm responsible for in the council to make sure that their funding doesn't get cut, to make sure that to find ways for us to get more money to them because of the God's work that you just heard them describe. Yeah, it's just a privilege. I'm sorry. I'm going to turn it over to the community board to ask questions because I get to talk to you all the time, but you should all know it's just such a privilege to work with you. Dedicated, smart, people who really care about those who whose voices are not heard. So I really, really appreciate being here. Thank you.
Thank you, Helen, for all your wonderful work in the council on these type of issues and other work too. Thank you. I appreciate you being here this evening. Okay, I have one question to start us off and then we'll go around. In non-COVID times, I'm curious from the various agencies, do you get referrals from our public schools and other schools? And follow up, and what happens when schools close from March to June over the summer and then a good part of into the fall? So whoever would like to take it. Go ahead.
I could.
Nancy.
So in the child, it's a great question. In the child advocacy centers, historically, the overwhelming reporters of child abuse are school officials, they're teachers, and we did see a big drop, in March and April in just reporting. Our numbers dipped way down for 2 months, and quite frankly, they're back up again. What we have seen, I think we're maybe about 20% less than we were, but the cases that we are seeing are all serious. I think just proportionately, we're seeing a higher number of sex abuse than severe physical abuse, but we're also finding the reporters are a little different, that it's family members calling in on other family members, it's hospitals calling cases in, community service organizations. So it is not, which has historically always been kind of the school officials. I do think they're getting some training. I think, the Board of Ed of DOE of how to kind of see kids, remotely and try to have eyes on them. But we are finding it's more concerned neighbors, family members that are calling in reports.
Okay, Lynn, do you want to answer that?
If I can effectively unmute myself without my glasses on. What was concerning to us is the dip, because I agreed with Nancy completely. A lot of the referrals on child abuse would come through the school system. And so when that closed down, it sort of puts an ice dagger in your heart, wondering what's happening. What we were seeing with our adults, we did go fully remote. Interestingly enough, the clients that we continue to have, we maintained our caseloads and then some, and people were coming to all of their appointments. They really needed that connection, and they really needed an opportunity to not be so isolated. But we had to get super creative with how to create space for them to be able to speak with their clinician, their therapist, without the abusive partner, the abusive parent that's in the home, knowing what they were doing. We noticed that the level of violence became much more serious during that time. There were many more of the survivors experience more physical trauma from their abusive partner. And we weren't hearing that much about the kids. So that's sort of scary. And at the same time, because adolescents and minors and young people have certain rights about receiving sexual assault care and mental health care without their parents knowing, because that way they'll at least access it. It might be safer for them to not let their parent know or their guardian know. We work with the school system to be able to connect with that young person. And that isn't possible when they're quarantined at home. They can't really get an appointment with a therapist on Zoom because the parent is right there. So it's been very challenging in that way. And the therapists have been extraordinarily stressed about it, but trying to be as creative as possible.
Okay, thank you.
Can I quickly chime in?
Please go ahead. Please.
So what was interesting was that during the summer, especially, the cases of sexual abuse that were coming into the hospitals were higher than the ones that were coming into that were adults. And the reason was because that were being reported. The reason was because parents were bringing children in for a physical exam for a sickness or something else. And then the pediatrician would notice that there was more going on. So that was probably the only, just like Nancy and Lynn said, obviously the schools are the main source of referrals, but this was an interesting shift that we saw in the hospitals.
Okay, very interesting. Okay, Catherine?
Thanks to all of you. It's so great to see you. I want to just I have two questions. And one has to do with how we can be useful or helpful for you in your work. We've talked about, Sarah, you and I have talked about a lot of different issues kind of in planning this meeting. And tonight, we've talked about the need for more forensics and trauma-informed practice training, free psychiatric care for children. And I'm assuming there's a need for more child advocacy centers or support for those that exist. So what I'd like to raise with the committee is the option of maybe choosing one of these areas to focus on, maybe postponing our upcoming meeting agenda, so that maybe we could focus in on one of these areas again for January, and then just push back our schedule for by 1 month, if that's okay with everyone. That's like an option. But just to ask this everyone who's here, like, what's a priority right now in terms of where we might be able to bring people together or advocate for something that's very specific and that's urgently needed. That's my first question, and also something for the committee to think about. And then also a really great point that was raised at the very beginning is the difficulty of children disclosing and what we need to do to kind of help and create a supportive environment and relationships for children to disclose. And so I wanted to hear, I actually teach writing, and so a lot of this comes up when students write. But how can we create opportunities and kind of empower children to have more voice, and to give them communication tools in a way that's safe for them? And so those are the two questions that I have. The first, what can we help you with in terms of advocacy or bringing people together? What's a priority? And the second, what are some strategies, what are you working on, and what can we do to kind of create more supportive environments and relationships for children to disclose? Or ask questions, or just communicate about sexual abuse.
Well, for the second question, I remember when I was doing specifically education with kids, back in the day when we used to do good touch, bad touch, and just say no and tell someone kind of stuff. What became apparent early on, and I think is still probably, to my mind, one of the priorities is what John was saying earlier, that you have to start with the adults, ironically, because the adults have to be able to hear it and be receptive. We know from research that how a survivor is treated and responded to upon that first disclosure is the best indicator of how well and how quickly they will recover. So having whoever that adult is going to be able to hear it and respond compassionately and to believe right away and figure it out later, but in that moment really be there for that child is key. And it's not just how do you react when a child says this to you, but what is your behavior in general? I remember a parent telling me once that their child hadn't reported sexual abuse that had been going on from a neighbor for a long time, because one night they were watching like the TV news, And there was a pedophile who had been caught, and it was on television. And the father had said, if that ever happened to my kid, I'd find the guy and kill him. Didn't say it to the child, wasn't trying to make any grand statement, but the child absorbed that and said, if I tell, my dad is going to hurt the person and he is going to go to jail, and that is not worth it. I can't disclose it. It's like a protective factor for other people. So it's reaching adults, I think, with how to live in such a way around children that invites or allows an avenue for a disclosure to happen and then respond to it appropriately.
Just to piggyback off that, I think Lynn really said that well. I think after talking to a lot of presentations I do is just talking about being comfortable even with private parts names. Just to give an example, I had a friend of mine who knows what I do, obviously, and when his children were young, around 2 and 1 years old, he asked me, he goes, John, like what names do we should I use with our kids, or private part names? And I was like, well, how about penis and vagina? Like, how does that, when he goes, oh my gosh, because I don't know if I can say that to my kids, and I'm sure, I'm sure if we went around the room, or the Zoom room here, that each of us would have different private part names, or names that we've used with our children, or when we were children. And really that's about us as adults, as even Lynn was talking about, being uncomfortable ourselves. It's not the children that are uncomfortable, but it's the children ourselves being uncomfortable with just even talking about private parts. So I think it's small steps like that, because these are important. And I always like to bring this up because, like I said, I've done over 1,000 interviews. A large majority of those were sex abuse interviews. And I get concerned because when there's a 4-year-old who says during that interview that my uncle put his finger in my pocketbook. What does that mean? And from a criminal standpoint, from an investigative standpoint, that makes it very difficult to move forward, because pocketbook, like, well, what does that mean? But what's one name we heard many times for children use for a child's use for the vagina. And so it's concerning for that investigation then, but I feel like it's even more concerning for how many parents have heard their child say that, their 4-year-old, 3-year-old, 4-year-old, 5-year-old say something like that, use a term like pocketbook, and assume that they're really talking about the little pocketbook they carry around. They don't realize their child is even being sexually abused because they're not using the term vagina. Or penis for that matter. And because we as adults, and this is where our responsibility comes in, to be more, give them the words to use, how to communicate even when they are in trouble, or communicate when they're, when their friends are in trouble or talking about things, or how do we help? We as adults have to take that responsibility to know better how to talk about sex, for one, be more comfortable with it, to talk to our children so we can do that, but also sex abuse, how that is such a taboo topic, and we feel uncomfortable, and children pick up on that and then realize, like, if my parents aren't comfortable talking about it, then I'm not sure I'm supposed to talk about it either. And we see that even after a child, and just to add to that, I think along those lines, for parents to realize, we know statistically over 90% of the sex abusers are people that the family knows. They're not the myth of it's a man who wears a trench coat and lives in his mother's basement. That's not a reality over 90% of the time. So I can't tell you how many parents, after we've been through an interview with a child who's given explicit details of being sexually abused, they have no doubt in your mind. You walk into that room and tell their parent, like, what's has happened, and the first response is, it couldn't be. He's such a nice guy. He's so great with kids. He volunteers his time. He's, and I hesitate to say that because I don't want to think all men. I'm a man. Like, I don't want to think that men who do that, because that's a great thing too. But sometimes we're in such denial, or even the thought that something could happen, and the awareness, because it's such a taboo topic, we're so uncomfortable that many times things are missed as a result. So just being aware and feeling more comfortable to talk about those things is a huge step in kind of the work, and for even as Lynn was talking about, there's a stigma there that, like, oh, I can't even talk about this, like somebody might get killed, like as a child. children pick up on those things very quickly and incorporate that into the way they think about things. So those are just some thoughts.
Okay.
So having a concrete language to talk about sex and sexuality and bodies that's like specific and concrete, that's a kind of a shared language. And then also demonstrating comfort and instead of like shame around talking about those things, and going to what Sarah was saying earlier, also kind of putting children in a position of power where they can where it's okay for them to articulate what they feel and what they're experiencing, and that they have kind of rights over their body, and that they can kind of express that and ask for that and be heard. So is it all those things?
Good summary. Good summary, right?
Yeah. I just want to jump in. I think just specific for your community on the Upper West Side, I think what would be, what we're all saying is to make these kinds of services accessible, right, for your residents. I think that's the main thing, because again, as Lynn was saying earlier, it's hard to venture further than your neighborhood for a weekly appointment. And that is what this would be. And so a clinic that is similar to what a CAC does, which is warm and welcoming, has child-sized furniture, has people that know how to address sexual abuse and the language, has a psychiatrist, who can treat children, who is familiar with abuse, and then has, within the Mount Sinai system, has direct contact with folks that can refer, that they can refer to for a forensic exam. That, I think, is sort of what your community can, just if we're focusing on Upper West Side, I think that would be helpful.
If I could jump in on this just a little bit, there's specific funding that each council member is allotted to give in their community to address these issues. And there's no doubt other communities have it, so much times worse than we do. And in fact, the money is allotted based on the number of 911 calls that are made. And not surprisingly, on the Upper West Side, we get a smaller amount of money than, Richie Torres in the South Bronx. But we get funding as well, and we distribute that funds to pretty much everyone on this group, on this Zoom, who do an amazing job. But one thing that I learned is that the Upper West Side is not, it's not like there's anything special about us so that sexual abuse, child abuse isn't happening. I mean, there's very little correlation to wealth. And one of the arguments I try to make in the council is, okay, it's worse in the Bronx, but you have to give my community money, because the 1 in 10 number applies to the Upper West Side. And I've now gotten to know the places in our community that are pretty hidden, unless you know about it, that take care of kids who have been sexually abused or are there for adults, different therapy. And the wait list, similarly, very, very long. You can't get in. And at some level, it's even harder for Upper West Siders because they don't qualify for the free services, but it's not, they're all different levels of economic, income on the Upper West Side. And there are people who fall in the middle and really need the free services, but can't access them because they're just a little bit, they're above the poverty line. If I can, I'm going to brainstorm an idea. I'm going to take Catherine at her word and just brainstorm an idea that we've talked about with the agency called NGBV, which is the city's agency to address gender-based violence. And that is the child care centers are often in the family justice centers, not often, not all the time, but like in Staten Island. And there's only one per borough. And it's always struck me that the one in Manhattan, you know, is down by City Hall. It's there for a reason, great transportation, you know, it's sort of central for that reason. But I've really been wanting to see a pop-up family justice center in Washington Heights, for example. You know, again, close to transportation. But I think advocating for some more family justice centers would be welcome. It's kind of like our own West Side campaign against hunger. You would be surprised how many people in our neighborhood they are feeding today. The numbers are increasing every day. But they also take their van, for example, and take it to Washington Heights in order to help there. So one idea is sort of a pop-up family justice center. These are city-run centers. I don't know, maybe a pop-up child advocacy center. I don't know what that is.
Sarah, can you talk about the difference between the family justice centers and the child advocacy centers so people can understand the difference? Would that be possible, Sarah?
Yeah, sure. And John, please, Nancy, chime in as needed. So the Family Justice Center was an initiative by the mayor's office to end domestic and gender-based violence. And that is a one-stop shop for anyone who has experienced, domestic violence or sexual violence. And you can access NYPD there. You can access counseling. You can get any kind of case management help you need. Legal services, prosecutors' offices are located there as well. Housing services. So anything that you need to get out of that abusive relationship or support while you are in that abusive relationship. They also have a children's sort of, it's called the Margaret's Place, which is a children sort of a daycare facility, which isn't daycare, but it's basically when the parent is coming in for services and they can't leave the child anywhere. So they have a space there for children to wait while the mother or whoever is the guardian is there seeking help. So that is the Family Justice Center. There's one in every borough. And then the Child Advocacy Center is run by Safe Horizon, it's a different entity, but they are basically also sort of a one-stop shop, but also have NYPD, also have prosecutors, and a child abuse pediatrician, counselors, everybody, and they're entirely focused on children alone. So anyone that has a referral, has a case that has gone through the Child Protective Services, which is ACS in New York, or if a police case was filed, they can then be seen at the Child Advocacy Center for services. Whereas for the Family Justice Center, you don't need to have an active case.
I wish that was true, but just so you know, I wish that was true. Tomorrow morning at 9, we're having a meeting with the top leadership of all the CACs, because there are about 60,000 child abuse reports, coming into the state central registry every year. And our child advocacy centers at our peak can manage about 10,000 of them. And that's, just our physical size and location. So we have been forced to kind of only deal with the most serious. We're having a discussion tomorrow about rethinking, are we getting, I want all these kids. I would love to see all 60,000. But we're daily kind of having to make these horrific decisions about, which families really could benefit from this. And quite frankly, which ones is it intrusive and shouldn't be coming to our doors altogether? There's a disproportionate amount of reporting of kids of color. You know, we could have another whole conversation about that. But, you know, my immediate worry is I do think we're going to get hit financially. And then I just am very worried that just our core services of each of the 5 CCs really remain open and can provide vital services for these kids and families for the next couple of years, just because I do think the amount of suffering, the loss, you know, Helen, you were referring, you know, it's just, people are hungry, you know, so as horrible as sex abuse is, you know, some of them, quite frankly, are most concerned about being evicted tomorrow or, you know, literally being homeless. So, you know, I just feel, I also think we need to kind of deal with the reality of these are going to be really rough times. So I'm just thinking of, if they're tough financial times, you know, what are the essential services that we absolutely need to continue, even if they're reduced a little bit, which I hope not. And then I just think we have to get super creative about how do we share or better coordinate the extremely limited mental health treatment services, psychiatric services, which I think you were referring kind of increase of suicidal ideation. We're seeing that as well. These kids are suffering, you know, and I'm really worried about them. So I don't know. There's a lot of need.
And
Yeah.
there's 5 child advocacy centers, 1 per borough. Where's the one in Manhattan?
That's where John is. He's up in Harlem.
Yes.
He's there right now, 122nd Street.
And Park
Okay.
Avenue, yeah, 122nd and Park Avenue, yeah.
Mhm.
Okay.
Robert, I saw your hand before.
Yeah, hi. This is a very impressive panel, and I'm very happy to see that the work that we're doing on the board and HNHC, our meetings are becoming more concrete, that our meetings are having outcomes where proposals are being established and work plans are being listened to and agreed to correct some of the issues. I have quite a long experience as a supporter, member of the movement, and vendor and employee of in DV with the Violence Intervention Program, which I'm sure you know, VIP, from 1984 to 2008. So I have 3 questions, and I think that I'm not sure what the importance of the order is, but to bank off the theme on children, and it would be the therapeutic theme, that does the child have an inborn sense of loyalty? That is, can he feel or she feel that they're betraying the family, either the parents or a good neighbor that they see frequently enough? The word betrayal, is there such a thing in the child? And is that something that, is that a barrier? Is that a challenge that the therapist, to get the child to open up? Because speaking up equals betrayal in many cases. And so is that one of the issues? I see that Ms. Arno is nodding, and I don't know, I'll hold my, should I just list my questions, Shelley, or should I just wait until?
Let's do one at a time.
I
Okay.
bet John's nodding more than me or Sarah, but John, you want to chime in? Betrayal's a big one.
No, yeah, I think you're absolutely right, Robert. Thank you so much for bringing that up. I mean, there's so many things, but I think what we often don't think about, especially when it comes to sex abuse, is that there's a relationship there, mind a very warped and manipulated one. But I've had many kids who, even during a forensic interview where the abuse has happened, they don't want to talk about it because their fear that they're going to upset the person who is their abuser, who's sexually abusing them. The fear that they may go to jail, the fear that they may get in trouble. I remember interviewing an 11-year-old boy who was sexually abused by his babysitter. And that was, as we're talking about, he finally told what happened. And at the end of the interview, I asked him, do you have any questions for me? And his only question was, he's not going to get in trouble, is he? And that was his concern. His concern wasn't for himself, for his family. He was concerned that this person who had developed a relationship with was going to be in trouble. And so that's very much a barrier. And there's there's so much that which, like I was talking about before, if over 90% of the time it's somebody who they know and trust. And so they're worried about portraying that individual and portraying their family, who also probably knows and trusts that person too. So it just, you're exactly right. And it can make it very complicated.
It's also more complicated with the culturally specific population. There's the concept of filial piety in Asian culture. There's also joint family systems. And so imagine, and of course, what we call the shroud of secrecy around it. So anytime a child speaks up, there's ramifications. So that sense of loyalty is invoked upon quite a bit.
Okay.
Thanks.
Robert, number 2.
Well, since Sarah just touched on the cultural, my next, it's not really a question, it's an issue because it's there. I've always been very, doubtful is too strong a word, but the whole idea of cultural diversity, when you're dealing with as many cultures as we're dealing with now increasingly, and with the cultures that we're hosting, bringing with them their culture and their beliefs and their privileges, and the whole thing on the child, raising the child, what is child abuse? And we don't want to go into honor killings, and we don't want to go into this and that and the other thing, and this is a difficult one for this panel in a public discussion, but the way Sarah was saying that there are cultural issues with respect to, I'm thinking of adults, and I'm not thinking entirely of the women, because in my experience with the clients, of course, at VIP were all women and children, and they're protecting the women and children. But even with respect to the boys and the husbands and the brothers that were looking for the women, there's the question of, I have a right to get my woman back. And the boy feels that it is his role to report where the mother's living. And I've dealt with some of these situations personally and as a property manager for the agency. And so the whole question of cultural diversity in addressing this, in that it's like a separate context. And the challenge is quite an important one, because we have cultures where, if you're talking about sexual assault, is genital mutilations considered sexual assault? You see, what are the definitions and what are the rights that cultures have with respect to their own children and within the context of their culture? So it's not one thing that you have 2 or 3 neighbors, but we're developing communities of culturally specific identities where.
Robert, I see a lot of head nodding. Anybody want to share anything in particular, or just?
Do you get my point though?
Strongly, go ahead. Okay.
Go ahead, sorry. Oh, ready. I mean, I think you bring up an incredibly important point, Robert, and something we deal with on a regular basis. One of the great strengths of New York City is its cultural diversity. But it also makes it much more complicated. And even people who have grown up maybe in a different culture and different understanding of even discipline, when you get to discipline, how do you discipline your child? And so, these are things we think about a lot and try to decipher as best we can. Obviously, in New York City, we have to follow the law of what that dictates, what is acceptable and not acceptable. And I know I'm really grateful that we have detectives who specialize in child abuse investigations, because they're also trying to decipher, like, is this an intentional, or is this a concerning situation? Is this a cultural misunderstanding? Not that they don't hold people to that law, but at the same time, there's some leeway in there they can try to make decisions based on that. So, and then, also education, and this gets into, I think somebody mentioned even in the chat about prevention, especially when it comes to physical discipline, what are alternatives to that? Even myself, I grew up in a family where that was just part of the culture. But what are alternatives? You can't just say, don't do that. But how do you say there's other ways of disciplining children, other possibilities, and not even to get into, certainly could get into more of like, what is the potential impact based on research we have about how that can impact children, even physical discipline, not to mention sex abuse and those types of things. But I'm going to let some of the other panelists, I think I've spoken enough. I'll let some other people chime in also.
Yeah, I mean, I completely agree. Robert, all of your points are so valid. And there are just so many nuances that we have to read between the lines. But, you know, none of that makes the abuse okay, right? And I think that's where the education that John was talking about comes into play. Like you know, there's so many cultural norms that are accepted. You know, what you were saying about the son wanting to, you know, share the address and stuff. I mean, that is something we see very often, and you know, especially in patriarchal societies, right? But it's our job to break those norms a little bit to help them see that, look, yes, we understand where you're coming from, but also that doesn't make it okay. So just questioning that a little bit and helping them see a different point of view, perhaps.
Okay.
You know, Robert, we've had 2 hearings on FGM. It was interesting to hear you refer to it. And at both hearings, everyone tries to be very culturally sensitive. But at the end of the day, it's illegal in the United States. It's illegal in New York. And people will be prosecuted for doing it. I think it is important that our educators understand about it, because children will, you know, say they're going home for their Christmas break and be all chipper, and then they come back and it's a changed person. So the city impressively is doing some education around that. They've done a great job at ACS educating the outreach workers so that FGM doesn't become a reason to take a child out of a home.
I'm sorry to interrupt you, Helen, but can you or someone define FGM? What is female genital mutilation, in case people don't know?
Yeah, so go ahead. FGM is female genital mutilation. It can be as much or as little, one way or another. It's mutilation. It's maybe one of the doctors could do a better job explaining the physicality of it, but it's a procedure that cuts the genitalia of a little girl, I think, so that they can't feel an orgasm. And it is something that is done in some cultures and has amazing ramifications for that child's life, even to the point of when they get pregnant and giving birth. And what do you do if the medical professionals that now young woman is seeing doesn't recognize or understand what has happened to the vagina? And so we have to make sure that our medical professionals are trained as well. And I think there's only one, I think it's only CUNY that's teaching about this. So we are actually working on legislation to require Department of Health make sure that the hospitals in the city and medical students understand it when they see it. Did I do a fair job, Sarah?
Yeah, so I just want to add that it's also there's 2 different things. One is removing the clitoris, and the other is actually sewing up the vagina. And it's done usually without anesthesia, and it's an extremely painful process. But it's also, you know, just imagine when a girl goes through puberty and is, you know, childbirth and all that, it just rips the pelvic area apart, and it can be very damaging.
And Robert, you want to do number 3 and we'll move on?
And number 3, well, first of all, thank you, Helen and Sarah, for even explaining it more deeply. Maybe as a defense mechanism, you you feel that you have enough knowledge and you don't really want to know anymore. And that's not denial, but you feel that you're being enough of an advocate just knowing so much. But when you have it explained by people that are more directly in the medical community, more directly involved, it just reopens your mind again to the atrocities that we're capable of. In any event, the third one is related directly to the title of our workshop tonight, and that's the training. Because we're talking about the ER staff, and and I've worked with ER staff since the 70s, but this was women. There was a group in the for the older people in the panel. I don't think anyone there was born yet. Only you and I, Shelley, up in the northern Bronx. I was director of the community relations at North Central Bronx Hospital, and there was a local group called Women Against Rape, and they were floating around trying to get entry into the hospital, and there was no unit that would sponsor them, as it were. People were sensitive. Certainly the ER, Dr. Goldfrank, very strong, but they needed a host. So they came to my office. I think I was in the office 2 days, and these ladies come to the office, 3 of them, Debbie Green and a few others, and they said we need somebody to help us. I said, well, you know, anyway, this long story short, they did get involved. So that was talking about rape protocols in the emergency room and training physicians and PAs and the doctors themselves. When a woman comes, what to recognize and so on and so forth. It's the very same thing that we're talking about today with children. But on training, and I think I alluded to this in one of our last meetings, Shelley, with the police. And I think we had a command or two in the audience. And I made the remark that, and I used one of the examples, very dramatic examples of maybe 10 years ago, 12 years ago, where these 2 strapping detectives right out of central booking responded to a call in Crown Heights. And they, you know, in those days they wore the suits, you know, right out of Mulholland Road, you know. And the fellow had come out of the house, it was a brownstone, and he'd come out of the house, he was standing on the stoop, and someone said, that's him. There was a big row, and he supposedly beat up his grandmother or something like that, really sick man. And detective number 1 approached him. Are you Mr. So-and-so? He says, yes. And he lifted up a shotgun and just blew this detective away. Of course, the second detective runs to action and he gets shot too. So they were both murdered right there. But that's just a dramatic picture. But in my work as property manager and a first responder for VIP, I would be present when the police were called either to move a woman from one shelter apartment to another. And on occasions, my hair stood on end, partially from shock, but also fear at what I heard uttered by some of the police that came to assist the counselors in resolving the issue where there was domestic, and there are always kids involved. So when we have these conversations, it's very difficult for me to separate child from mother. It's very difficult because they're always together. But the police need as much training as the medical staff that is looking at the child, because it's the policeman's sensitivity that can make the difference in any encounter. Whether you're talking about a child, whether you're talking about an adult, if the child is called to the home, and if the NYPD is called to the home, if he's not sensitive to that mother and that family, he's not necessarily going to be sensitive to the child, and he may not take it the extra mile that he has to as part of the solution. So the training, to me, of the police department is inadequate. Okay. And now we know that the police are human beings like you and I, and that they have issues at home, and that, you know, some of them are batterers and some of them are abusers, and we get, you know, headlines all the time. Okay. But the training, I think, falls short of what is needed in NYPD. So in addition to training providers in medical settings and sensitizing them and so they can recognize the whole thing. I think intensive training of the police is something that we
You
should
know,
have.
if I could just jump in on that as well. We had a full hearing about this a couple of years ago and passed some laws around training and staffing for the Special Victims Division and training for the police department as well. And I want to start by saying, Robert, your story about 2 police officers losing their lives because they've put themselves out there to try to help is heartbreaking. And every time that happens, it's unacceptable. We had that happen here in New York City. If you'll remember, a couple of years ago when 2 officers were killed while sitting in their vehicle doing nothing but being present. That's outrageous, outrageous. But I do think, though, that the police department has come a long way. And of course, it depends on the officer. But I was on the phone on a Zoom yesterday with a city official who was telling me that at any given time now, 65% of the police officers, so this is now 37,000 people who are out there, are trained in implicit bias and in mental health crisis, what to do in a mental health crisis, and which is the highest number I've heard. So I think the police department is trying. You know, sorry, I've been up since 8 o'clock. The other thing is that the city has now set up these mobile crisis teams. So that will go to an emergency, what do they call an EDP, an emotionally disturbed person. So for those calls, I think the city is trying hard to have a team of individuals to include not just social workers or mental health professionals, but also having the first responders be better trained at de-escalating, at noticing what's going on and trying to calm the situation. These are just horrible, horrible instances, and things can go wrong like that. And you're right, better training of all involved is the answer. The city's goal is to train all of the EMTs within the next fiscal year in crisis response and trauma-informed crisis response. I mean, even the language that the police department and City Hall is using is at the standard that the advocates have been calling for all these years. It's incredibly important.
Great.
Helen, before we go to our next committee member, can you share the idea that you shared with me about our next meeting, the CVAPs?
Yeah, so John, I forget who mentioned it, John or Nancy, that Safe Horizon staffs every precinct now with a crime victim advocate. And so that's what CVA, I don't know what P stands for.
Crime Victim Assistance Program.
There we go.
Can you say it
But
again,
the city funds this now. Thrive funds it now. There are 2 in every precinct, and I talk with them regularly. They're just terrific.
please
And
repeat that name.
Crime Victim Assistance Program.
Yep, thank you.
And there are 2 embedded during the day hours at every precinct. And I think it would be interesting to invite them in. I don't know if they can work their hours, because this would be a night shift person to come for a community board meeting, but I'm sure Safe Horizon can help bring someone in. honestly, they are busy on the Upper West Side. You know, abuse it comes at every socioeconomic level. And the CBAPs in our district are very knowledgeable, know the families where things are happening. During COVID, they're working harder to do outreach with the families that they've been working with. And I'm very close also to the PSA officers at Amsterdam houses, which are the police officers. They are trained, very well trained for the NYCHA residents to have somebody to talk to. And they're doing more outreach now during COVID, you know, unrequested, but just outreach. It's an amazing thing. And it's all Safe Horizon. And kudos to them.
Great. Thank you so much, Helen, for that great idea and to share that with us. I just want to remind everybody just about timing, because I can't believe the time has just gone by so fast. We've all been learning so much. So it's 8:50, and there's a few others on the committee that I think we still need to hear from. And then also, I know that there's a number of people from the community board here, and then we also have 3 people that signed up to speak from the public. So I just wanted to remind people of time. And who's next, Shelley?
Okay, Madge?
Yes, you mentioned outreach, and this is for Helen or for anyone who wants to answer. During COVID, with the schools closed, and people, I'm not saying something against the police, but a lot of people are too afraid to go into the police station. How does somebody get your help? How do they know you're out there?
You know, if I can jump in, because this was a really hot button issue for me, Madge, and really pushed the City Hall to make sure that groups like Safe Horizon and the Violence Intervention Program, which Robert is talking about, that they had funding to message out to all New Yorkers that their doors were open for people. And one of the things that we got the Department of Education to do was we helped them develop a flyer, and NGBV, you know, I think maybe Safe Horizon helped with it. That was English on one side, Spanish on the other, and we put them in all the grab and go meal bags.
Great. Oh, great.
So just getting the word out that services are available. That's primarily to parents, though, and, you know, which is different than child abuse, but this was primarily so people who were survivors would know, because many of them have been locked in their homes now for months.
Thank you.
Thank you.
Rosa, do you have a question by any chance?
Yeah, I do. I know that
Please.
the Mount Sinai person spoke about multilingual services, but I wondered if Safe Horizons and New York City Alliance also have options like that for everyone.
Great question.
Thanks.
Okay.
I could jump in. I mean, John might tell you specifically, but we have multilingual. I mean, I don't know. I think we once kind of like over 50, I don't know how many languages, but you know, we really are trying to have our staffing kind of be more representative of our communities, of the clients we're serving, the languages, the cultures, the races. So, and we do have interpretation services, sign language. Yeah, we pay a lot of attention to that. Good question.
Yeah.
Yeah, I mean, same as Andy said. I mean, I know at the Manhattan Child Justice Center, we have it's between 8 and 10 languages, I think, are represented from our staff. And we also really try to know and find places, oftentimes people within their communities, like that have specific language. So yeah, that's definitely something we do the best we can to find that specific language, and cultural understanding, I think, is also important along with that language. So yeah, absolutely. It's a good question.
Okay. Any board members?
Sorry, but just in case anyone from City Hall is listening, we don't spend enough on the many variety of languages that are out there. In Jackson Heights, 157 different languages are spoken.
Good point.
Thank you.
Any other board members who?
Doug Kleiman has his hand up.
Okay, please.
Once again, Catherine and Shelley, kudos to you for putting together such an incredible panel. All of the panelists are so impressive. This topic is very near and dear to my heart, and Catherine knows that I was advocating to have a friend of mine on the panel, but perhaps we'll have him another time. He's a former FBI profiler and a specialist in child, crimes and sex crimes specifically against children. And I've been privileged to be friends with him for about 30 years, and I've learned so much and attended many of his trainings. You may know him. His name is Jim Clementi. So he's taught me a lot, and I'm not an expert, but he is, and you all are. A couple of things that just takeaways that I'm hearing tonight. Obviously, prevention is a huge word that's been said quite a bit. Teaching and training, and of course that all starts at home. Even the best intentions, as was described, where people, just using proper anatomical names for genitalia and getting rid of the shame around it, and so that children can feel comfortable and not be shamed or fearful when they want to describe or point out where they were possibly touched, or obviously, ideally to be preventing that. Also, the proper boundaries and being able to say no as a child, and not to obey any adult just because they're an adult, because that is incredibly dangerous. And what was my friend taught me, the most benign sort of example of that is when a parent innocently might say, well, give your aunt or give your grandma a kiss. Well, they don't want to give them a kiss. And then they learn that they should do something that they're not comfortable with. And that's the beginning of not having better boundaries. So respecting the child when they say they don't want to be held or they don't want to kiss someone or be kissed. One word I didn't hear tonight, which I'm sure all of you are very familiar with, is the word grooming, which is incredibly important. And this is how perpetrators get access to children through a very protracted, sometimes days, weeks, could be hours, could be years and years, a lifetime. And so access is another thing. So where any child has access, or anyone has access to the child, so that's obviously houses of worship and schools and anywhere else, and doctors. Sadly, the amount of crime that is committed by professionals is astounding and particularly heinous. So I just wanted to say that this is an incredible, panel, and it has to be repeated. And because I think it's very important that everybody gets the message at home, and just to learn how better to prevent it, and then obviously to report it. Hopefully we'll have my friend on here sometime in the future to offer his true expertise. Two quick questions. One is all of the volunteer and training, because the predatory nature of these awful crimes is so it's so prevalent that even the volunteers and the professionals have to be screened. I mean, you look at people like Sandusky, who was put away, he had access, right? Bill Cosby had access and power. Those are grade A offenders because there's trust in the society. So the two questions I have is, how are the professionals that are intervening with the children screened themselves so that they do not re-victimize a victim? And the other quick question is, now that everybody's quarantining, it's so much harder to report. Are there certain safe phone numbers, code words, signals, verbally, non-verbally, that children can use or adults can use in reporting when they may be confined in the home with someone who is perpetrating and victimizing them? Thank you.
I can speak to how we screen our folks. So I said we have about 193 certified advocates, all as volunteers. They go to all of the emergency departments. They're only, first of all, they stay entirely in the emergency department. So they never go outside. If a patient might want to go out and have a cigarette, something like that, they don't ever go out with them. So they're always in the confines of the emergency department. But we do an extensive screening. They have to agree to a background check. They have to do a drug tox screening. They do a medical clearance. They do multiple interviews, both in a group setting and an individual setting. The entire way through our 40-hour training, they're continually evaluated. And not everybody graduates, quite frankly, from our training. If we don't feel like they're the right fit for this specific kind of work, then, and we are very upfront with them in the beginning that not everyone graduates, that my priority is the survivor and supporting them as safely and as fully as possible. So if this isn't the right fit for you as a volunteer, I'll help you find something else, but I'm not just going to graduate you and put you on our roster. And it's pretty much the same thing for our staff, that they have to go through extensive background checks through the Mount Sinai health system in a lot of different ways before they get brought in. So we do everything that we can to ensure that the people that are working with our survivors are there because they want to be helping survivors and for no other reason. They don't have a history. We also have a policy, for better or worse, that we will not serve offenders. So we can, if someone has called us and this has happened, that they're concerned about being an offender or being an abusive partner, we cannot bring them into our office to see them where there are so many survivors who are coming. But we also want to acknowledge that if we don't address perpetrators and offenders and stop the people who are doing it from doing it, then this is never going to stop. So we have to be able to connect them to some sort of resource to the best of our ability. And I know that there are groups of us who are working on how do you have a more effective abuser response. You know, the anger management isn't it. It has never worked. It will never work. We have to do much more on the offender side. But it's another way that we try to make survivors as safe as possible, not bringing offenders into that environment.
I could just chip in real quick. You know, that Safe Horizon also does extensive background check screening, you know, for all of our employees, including our volunteers and student interns. We have quite a number of interns as well. I'm also kind of proud that through our anti-racism work also, though, that if somebody gets a hit, you know, with some kind of an offense that doesn't relate, you know, to their job, that we're not automatically also prohibiting them being hired if we think that, you know, that's not really going to impact their ability to do some work with us. So.
Can anybody speak to the signaling of when people are in the homes and near their offender that they can report? Is there any method for that?
So I don't know if there's like a universal method. I know that's been a big issue literally since March and trying to identify when schools closed. That's happening with the Board of Education, that's happening with ACS, that's happening in hospitals or different places that have been doing everything from like focus groups, trainings, how to better identify that. And we actually are seeing that more. I think we're seeing more reports from schools reporting that they've seen something on virtual, you know, in the homes or children are reporting back to them. And maybe related to a variety of factors of children becoming more comfortable in kind of the virtual world, if you will. But yeah, those are definitely things looking. So there's not, I don't think they're publicizing a specific, like make this hand signal, that kind of thing, but with teachers and school staff are getting that training and looking at different methods of doing that for their particular class. And of course, age group, I mean, different, depending on that child's age and development, it might look different too, but that's definitely something it's been a big issue. And thank you so much, Mr. Clement, for mentioning different things that you mentioned before. I definitely agree with that in prevention. I also think about you mentioned just briefly, like the different agencies and organizations. I think it's also important to consider the policies around everything from like, places of worship or other organizations where families and children are attending things, that you're considering the policy around that, like children's going to the bathroom, like who's in those, like how, like all those types of things, who's alone with children, how are children separated from their families, all those kind of policies, which are important to consider in communities wherever you might be.
I underscore the Boy Scouts.
And Doug, if I could just mention a couple of things in response to your question. The last part in particular about code words. A couple of localities across the world actually have tried that out during COVID, and they're having a code word that you can use with a pharmacist. And the jury is still out as to whether or not that's a meaningful thing to do. But there are people in the city who are watching that very closely and, seeing whether or not it's effective. The head of the WHO, when COVID hit, said the people we should care most about are the women who are vulnerable home now with their abusers 24/7. And that's who we should be paying attention to, obviously, in addition to the health concerns of everyone. And I don't think New York City has done a good enough job making that a top priority. But I also think it's important not to sensationalize abuse of any kind. Abuse, talking about, making sure our laws are strong around not having sexual predators, around our schools. Of course that's important, but oh, by the way, if you're wealthy and you're a predator, you're not on that registry. And more often than not, and again, just trying to be clear about the Upper West Side, we might not have registered sex offenders, but trust me, there's a lot of bad stuff going on behind closed doors on the Upper West Side, and people aren't talking about it, and they're getting away with it. And so for us, as chair of the committee, I work on, the whole city, but for us on the Upper West Side, it's really important to step back from sensationalizing things and know that there are amazing professionals out there. We're seeing the best of the best tonight, Savvy, Safe Horizon, New York Alliance Against Sexual Violence. These are trained professionals, serious people doing serious work on this. And it's a lot of respect goes to them. They really know what they're talking about, and are light years beyond sort of the cheap shots that it's easy for people to make.
Just to respond to Helen really quickly, and also Doug, and just to build on what Helen just said, I think what was noted at the beginning of the conversation that most sexual abuse happens with most perpetrators are people that children and victims of violence know. So they're known offenders. There's a great, I think Sarah also mentioned the need to focus on offenders. Was that you, Sarah? And kind of reducing violence. There's a great book that just came out that's called, in the last year, that's called No Visible Bruises. It's by Rachel Louise Snyder, and she talks about strategies that governments are using to reduce violence that's more focused on perpetrators. It's a great book. And Doug, we'll have Jim Clemente. I know he couldn't come this time, but we'll definitely have him come another time. So Shelley, are there other community board members that want to speak before we take public comment?
You have a hand at last opportunity.
Well, we can always come back. Why don't we go to the public?
We also have three people signed up.
We have two focused on this topic. So we're gonna start there. The first one that signed up on this topic is Melinda Thaler.
I just promoted her. She should be able to unmute her. Melinda, you should be able to unmute yourself.
Okay, can you hear me now?
Yes, we can.
Okay, I didn't mean to. Oh, I can start my camera too. Okay. All right, don't take that out of my 1 minute. Okay.
No.
Hi.
I'll time.
Okay.
Sorry.
My question is open to any of the panelists, but I did want to particularly call out the two Safe Horizon presenters. I am actually myself a former Safe Horizon employee, and my children and I are also beneficiary of your crime victim services. So I've been on both sides of your Safe Horizon fence, and I can say you're fabulous in many ways. I noted that Ms. Arrow mentioned that Safe Horizon is present in many places, including all of the precincts in New York City. We're living in a time where there are loud calls for defunding the police and even abolishing the police. And given that Safe Horizon does have a presence in every police precinct in the city, I wanted to hear your thoughts about whether police can have a diminished role in child abuse and intimate partner violence services. And if not, how should their role be right-sized?
Wow, good question. So I could just tell you, in a minute that we are actively engaged, the leadership of our Crime Victims Assistance Program and the police department, that I think all communities want to be safe. And I think there's a recognition even within the police department that we can do it better. We can collectively and individually respond to victims in a way that's trauma informed. I think with all that's going on in the city, in this country right now, there's a real reckoning of people wanting to be treated with respect, police officers, victims. So we're taking the approach of doing a lot of self-reflection within Safe Horizon, being accountable of what can we do better, looking deeply at our own practices, our own responses, and we're really excited about working collaboratively with the police department. I'll just say tomorrow afternoon, actually, I'm in a racial equity work group meeting. It's a tiny little work group meeting with some of the leadership of the Special Victims Department. And we're doing some self-reflection. NYPD leadership's doing it, Safe Horizon's doing it, ACS is doing it, the DA's office is doing it, and a medical professional. So I think it starts with us, individually, like, what are we doing? Can we do it better? How is race playing into everything? And then we're looking at how do we support each other in doing it better. So I just want to let you know I'm super committed to this. I know Safe Horizon's super committed. We have a long way to go, but I feel like this country seems ready. I think our city's ready to dig deeper, and let's do it better.
May I just ask the name of the woman who asked the question?
My name is Melinda Thaler.
TH?
THALER.
Thank you.
Thank you.
You're welcome.
The next speaker
is Maria Danzalo, and you should be able to unmute.
Hi, good evening. I'm glad to hear the community board and Councilmember Rosenthal are very serious about protecting women, children, and other vulnerable people in the community against sexual predators and sexual abuse. I'm very curious as to Ms. Rosenthal's statement that of the use of the word sensationalizing things. I don't find it sensationalizing to talk about abuse of children in a way that we can prevent by looking at legislation and laws and tightening them up. There are a ton of loopholes in current law. And if anyone who thinks that there aren't loopholes in that law just hasn't looked at the law. I've looked at it, I've thought about it, I've advised people on it, and it is a very, very unclear law. As Safe Horizons speaker pointed out, they are required and the police are required to interpret current law. But if the law is unclear and confusing, how can they possibly do their jobs? So since August, I've written several letters on this to Ms. Rosenthal's office and have yet to receive a response. I now understand that perhaps the issue has to do with the fact that there are people who aren't registered in our community and should be registered. So under current law, only level 2 and level 3 sex offenders are required to register. Many of these sexual predators may actually have committed crimes at the level 2 and 3 level, many of the level 1s, that is, but because of plea bargain arrangements or other factors, they might not be included as a level 2 or 3. Also, certain other behaviors, such as public impropriety, may not rise to the level of a registrable offense and may not be considered dangerous enough to require registration. But witnessing public displays of inappropriate sexual conduct can be extremely damaging to a person, a child, a woman, or anyone who's vulnerable. So these are the kinds of things that it's insulting to call it sensationalizing stuff like this. There's nothing sensational about it. I don't really want to be having this conversation. I don't want to sensationalize anything. I want law that will address this issue in a way that's effective and that is going to protect the community. And I'm asking the community board tonight, this is an ask, to take on the issue of legislation, to look at level 1, 2, and 3 registrations and see what's going on with the law and try to provide adequate tools to the police and others who have to do their jobs in this space to protect the women and children and other vulnerable people we seem to need to protect so much. We have to talk about this. It has to get resolved. Thank you very much.
Okay.
I want to respond to that very
Tell
quickly.
you that I just checked. I'm seeing your emails. These are issues that we should have responded to you, just to let you know. These are state issues, not city issues. And there's so many, I agree with you, so many loopholes that have to be closed. But really, it's those are state laws. So you might want to direct those emails to your state representatives. Thank you.
Okay. Why don't we go on? Is there a third speaker?
I'm sorry, there is.
There
There is.
actually, there
Go ahead,
isn't,
go ahead.
there is not a third speaker on this issue. So I just want to finish with this,
Okay.
and then we'll continue to the rest of our agenda. I do want to say that I think that just to respond to the last speaker, thank you for presenting kind of another area that we need to draw attention to. I think we're all here to work together and on these issues. And we thank everyone for coming to the meeting to share their insights and ideas. We thank all the speakers for coming. We thank Helen Rosenthal for her great work. We actually, we have 2 more speakers on 2 other issues, just to let people know. So just to kind of wrap up this portion of our agenda, what do we think about, I'm asking this to the speakers that joined us today, everyone that's here from the organizations and also the committee. What do we think, would all of you be open to having part 2 of this next month and postponing the other issues by 1 month and focusing on one specific area, since we talked about so many different topics? And I think I want to listen to the recording again to kind of hear the specifics again, and then follow up with the organizations to see where we could target one piece. What do folks think about that? Both people that joined us and also Shelley and people on the committee.
Okay. I see a thumbs up from Madge, from Doug, from Robert.
Shelley?
Okay. Okay, Rosa. I think we have a consensus on this, but we don't want to overimpose on our representatives from the agencies. So we'll try to have a conversation with you and try to make it convenient and so on. But we appreciate it, and a great idea, Catherine.
Focus in on one area.
Right.
I think could be helpful.
I think it would be sad to take all we've had tonight and just move on to something else. I think it's smart to focus more specifically and to continue this. Okay, great.
We can follow up on that. And I want to thank everyone for coming. You don't have to stay for our entire, meeting. It's really late, but thank you so much for spending the time. And we will work very hard to think of ways that we can support your work in concrete ways. We'll process this and come up with the next step. So thank you so much for coming.
Yes,
Thank you, everyone.
So much. Yes.
Thank you for
Thank
having us.
you.
Councilmember, one of the next speakers has asked that she wanted to address part of her remarks to you. So if you are able to stay, that is her request.
Okay.
Happy to. I do just want to preface that I've been up since 8, had
Okay,
a press
we'll move it along.
conference at 9 a.m., chaired a hearing, had a briefing, and was at 3 Zooms tonight. So if I say something a little off, please forgive me.
Okay.
Thank you so much for spending the time with us, Helen. It's really glad to have, we're glad that you're with us and that you're
You're a
spending.
priority, Catherine, Shelley. This is a great hearing topic.
Thank you so much for being with us and your contributions.
Of course.
So let's move to public comments on the other topics. So Erica Gerson, you were the first to sign up as for a topic that doesn't have to do with the child abuse topic. So you're up.
Great. I started my video, but I don't see myself there. I'm not sure what's going on.
We see you.
We see you.
Okay, perfect. Oh, there I am. Sorry. Thank you for staying and hearing this. My question relates to the last meeting. Toward the end of the meeting, there was a discussion about, I don't remember the title of it, but basically the working group that was to deal with issues arising from the temporary shelters in our neighborhood. And it became clear that that group has in fact not met in a very long time. It may have met once and then not again, or whatever happened for quite a long time, it hasn't met. Shelley had suggested that he would help make sure that we could figure out what happened to it and whether we could get it rolling again. And in particular, there was a question about the good neighbor policy was never shared with the community despite many requests. And so I think Shelley was gonna see if this group could look into that so that we could actually get the good neighbor policy and figure out how to hold people accountable and what is considered violations and what's not. So I wanted to hear an update on how that was going. Of course, it's also interesting to wonder why nothing was happening all these months when there were still many issues that could have been usefully addressed. But for the purpose of moving forward, I would like to hear what we're doing to move this forward.
Okay.
Thanks.
On the good neighbor policy, we've done some research on a few good neighbor policies. Good neighbor policies are required by DHS, Department of Homeless Services, for each shelter. They're not identical, but they basically define the program and then specifically in relationship to the community, relate to things like people not hanging out on the street, not smoking in certain areas, and the type of interactions that go on. But good neighbor policies are guidelines that the community can call the provider on. If normally there's a community advisory board when it's not a temporary emergency shelter. And so they can address those issues there and have them responded to, or if it's something more serious, on a call line or an email. So I've experienced this with other CABs, community advisory boards. So there is a value to the good neighbor policy. What's clear is good neighbor policy isn't an enforceable policy. It's a guideline which is used as a kind of agreement between the community and the provider and DHS that certain things would be the right behaviors expected of people in the community living in that area. And they can be questioned and they can be brought up, and repeated violations I found with Lucerne also, people were corrected and in some cases removed if they violated those policies in a serious way. on the working group, we had 2 meetings, I believe, and I thought they were effective, but they weren't. No additional meetings were convened. I think the working group was an unusual creation. Okay, again, normally there's a community advisory board, so there's ongoing meetings. I think it's a shame it didn't continue because it was a vehicle to bring issues with stakeholders all in the same room, and I think it was a very positive thing. I think what I missed, which would have been more helpful, was an ongoing weekly or bi-weekly report to the community of what progress was being made, but it didn't pan out over time, unfortunately.
So is there anything moving forward that's planned?
I
think that's a great idea. A weekly update would be helpful. I mean, there's a lot of people that are saying disinformation here, disinformation there, but in the absence of information, people end up with disinformation.
I think that's a very good point, that when you don't have, what you hear on the street is what becomes the information, okay? And there's no other source. I think, Mark, tell me if I'm wrong, the borough president was the convener?
That's correct. The borough president and the other elected officials were the conveners, and we all tried to participate in that. I imagine, I don't want to speculate, but I imagine when things got into litigation, it got a little harder to move things in that direction. The community advisory boards that Shelley is referring to are not available for temporary shelters. And so the working group was our collective effort to try to fill in that gap a little bit. And that's all I'll say about that for right now. I think Shelley said it very well. But the idea of getting better information out faster, even in the absence of a meeting, is a very good one. And I'm happy to work with Shelley and Catherine and all of our electeds to try to see what we can do about that.
And can I just put a reminder to everyone about the chat, that we please focus on kind of issues, questions, but not make any negative comments about groups, including people who are experiencing homelessness. So please don't make any derogatory comments or negative comments about people experiencing homelessness. And thank you. To respond to Erica's, to get as much information as we can in response to Erica's question, is Helen still here? Can Helen respond to that as well? To provide any context?
I am here. Ooh.
Is there anything that you want to say to provide additional context? I don't mean to put you on the, I'm just wondering if you wanted to respond to that as well.
I mean, I think Mark nailed it. Gail has been convening these meetings, and Shelley talked about good neighbor policy and the community advisory boards. I think, you know, let me think. There is some new news. The population at the Lucerne has dropped significantly below 200. The only people now who are doubling up in rooms, I think there are 5 rooms now with doubles. And I don't want to misspeak, but I know some of them are doubles for mental health reasons. They don't want people to be alone in a room, which has been something that the nonprofits have been saying all along. I think that's new information. I know I think 50 guys are now working at Goddard. They're getting 6-day-a-week on-site services.
Do we have any information? This is kind of in response to something that that Gail shared at our full I think it's at our full board meeting. I can keep track of all the meetings. Is there any news about where they're going to go and if there's going to be a continuation of the services that they're experiencing here?
Yeah.
Like what's going to happen in terms of their having access to the services they have here or where they're going to go?
Yep. You know, the litigation, I think has been, the status right now of the litigation, there was I heard from the lawyer today, is that there is a stay that's been granted by the appellate court, and they are preparing for a case that will happen. You know, I'm so tired that I don't want to give out misinformation, but we could get the exact timing and the information from the lawyer. I also, I'm just sort of looking at the chat a little bit. If I'm wrong about the 50 men, that was what the lawyer announced today, was that there are 50 men working at Goddard. I could be wrong about that.
You know, Councilman Rosenthal, is there any progress, has there any progress been made on securing those jobs as a program, regardless of whether the Lucerne residents are still there? I know there are other hotel residents, and some people were hoping that that program could continue for whichever individuals that would qualify could have it, even if the Lucerne is emptied.
Yeah, great question. I don't know the answer.
Good questions to get answers to.
Yeah, let's follow up on that. So thank you, Helen, for being here. Thank you so much. And we will follow up with you. Thank you, Erica, for your questions. And we have our last speaker from the community is Pemi Sherpa, and I apologize if I'm mispronouncing your name. And the topic is food insecurity.
Hello, everyone. Thank you for staying up. This is my first time attending a community board meeting, and I really enjoyed it. Thank you so much. So I wanted to talk about food insecurity focused mostly among college students. So we all know that more than 2 million New Yorkers were food insecure even before COVID hit. And now that the COVID has hit like more than 1.2 million of residents, about 15% were food insecure, including 1 in 5 children. Now that the city has shut down and hundreds and thousands of New Yorkers have lost their jobs, the number of those relying on food pantries is only rising. So about 60,000 CUNY undergraduates and 25% experience food insecurity. And we all know what's being done is, like, in 2017, the New York City Council passed a bill which required Department of Education to submit the Speaker of Council and post on its website a report including data related to meals served by Department of Education to students and schools, including breakfast served before school and after school day began, lunch, after school snacks, and after school suppers. The report would provide information about initiatives and programs aimed at increasing student participants in the meal. So right now, I just wanted to introduce to a policy recommendation that is pretty new, that was developed on 2020. That was the intro to 2057 legislation. It's a pending legislation. So it was introduced in 2020 by the public advocate and council members to develop a plan to provide students with breakfast, lunch, and dinner in the event of city school are ordered closed either by the governor, mayor, or councillor, or when any form of remote learning is being used. So just wanted to, the bill is intended to reduce the administrative burden on school as well as the paperwork and financial burdens to families. So I just wanted to introduce to this bill and wanted everyone to support passing and enacting this legislation, because it will ultimately decrease the need for food for city schools.
Could you please give us the bill number again, the intro number?
Sure, until 2057-2020.
Thank you.
You know, Ms. Sherpa, if I could just jump in, thank you so much for raising these issues. The issue of food insecurity is a serious one, has been and continues to be. So the City Council has added funds to the budget for CUNY students. We set up food pantries at several of the campuses. We weren't able to fund all of them, but I know those pantries are open and giving out food. And for anyone in our community who's food insecure, if you go to my website, helenrosenthal.com, and click on COVID resources, we have a long list of food pantries that give out free food. Most of them don't require any information. I think the one that does is West Side Campaign Against Hunger, but they don't ask for personal information. It's more for their own tracking purposes. And I actually have a one-pager for anyone in the community who needs a list of how to get food on the Upper West Side. My office is closed, but I'm here all the time. And several people a day come by and ask for it. I have it in Spanish and English. Food is a serious issue everywhere, including the Upper West Side. So I really appreciate your bringing that up.
Thank you.
And we'll follow up on that. We'll look into it. We did have a meeting a couple months ago on how to address challenges associated with food insecurity and improve equity and access. And we had people come to our meeting who produced the New York Food 2020 report. Food insecurity has almost doubled since the pandemic started.
Yes, it's crazy, the number.
So we kind of outlined the recommendations produced by this report. And then called on the mayor to strengthen and expand the mayor's Office of Food Policy in particular. And to kind of share this with the committee, we've shared that resolution and also the anti-hate crimes resolution with the borough president's office. And Mark, I don't know if you want to clarify anything about this process, but those two resolutions are going to be shared with the chairs of the Manhattan community boards, the other Manhattan community boards, so that it can be shared with their members, because we wanted to distribute that piece about food insecurity and also the hate crimes wider than just our district and board. Mark, do you want to add anything about that, or Shelley?
No, you basically have it. This is the beginning of the process of trying to see if the borough board will stand behind what Community Board 7 stood behind. But it has to obviously be shared with the boards, and they have to come to their own conclusion before we can put it on an agenda for, they can put it on an agenda for borough board. So you got it.
So it might end up at best in January.
February at the earliest.
I'm trying to be an optimist.
The goal was, for people that don't know, Borough Board includes all of the Manhattan Community Board chairs. And so the goal was to kind of spread information and efforts at advocacy wider than just our district to those other 11 boards. So I think we can move now to new business, if there's any new business.
Actually,
anybody wants to raise?
Catherine, I'm looking in the chat and just can't find the exact bill you all were referencing. I know you put the link in.
2057, Helen.
Yeah, is that the one that I see it now? That would no, this is a different one. To your point about Catherine just now about having a better food policy. There is a legislation that's been introduced, and I will try to find the bill number that would require the city to have a more engaged food and meaningful food policy. And it would require it to have a, not just established by executive order, but by local law, an Office of Food Policy. It's not my bill, it's somebody else's. And if you email me, we'll try to find it and get it to you.
Okay, great.
you.
Thank you so much for coming to our
Thank you
meeting.
for having me.
Thank you.
Okay.
Any other comments from anyone?
Great
Yeah, my
meeting.
comment is that it's 9:40.
Want to
Yeah.
wish everyone a good holiday season for any holiday they're observing, or if they're not observing a
New
holiday,
Year.
just have a healthy, good season.
Thank you, everyone.
Have a good night.
See you in
Thank you so
2021.
much.
Right. Someone's, sounds like a Gregorian chant.
A little basso continuo there.
Okay. Have a good night.
Good night, everybody.
Thank you all.